you think you're infected, you're symptomatic, fever, cough, headache, and so you self-quarantine, how soon before you can return to social situations? Is it safe to say that when you're no longer symptomatic, then you're no longer potentially shedding the virus?
No, that's not correct at all. That's a very good question. You can get infected, become symptomatic, resolve the symptoms, feel well, and still shed virus. You can go back to your normal life when you have 2 consecutive tests for the coronavirus that are negative, separated by 24 hours. That's an excellent question. Just because you feel better or feel well does not mean that you're not shedding virus.
And Dr. Fauci, how certain are scientists about this 15-day quarantine period? That, I mean, I've seen online some reports of cases in China where people may have had it for more than 15 days or been asymptomatic, but carried the virus and may be infecting people past 15 days.
You know, it's pretty certain about that, Anderson. And if you look now, as we get more and more data, the median incubation period is 5 to 5.2 days. But the brackets in the range are pretty tight between 2 and 14 days. Whenever you have biology, there's always going to be the out-of-the-way exception. But for the most part, I think the operating definition of 2 to 14 with the median about 5 is accurate.
What supplies should I get in case my community locks down from coronavirus outbreak?
Well, people in their homes, even beyond coronavirus, should always, particularly people who require medication, should have some degree of stocking up of things in case there's any kind of a disaster, a natural disaster. But specifically for coronavirus, if you're going to be, confined to a place where you can't have access to things, I think the standard things, bottled water, making sure that if you're on medications, which I have to emphasize is one of the most important things, make sure you have your medications that'll take you through a period longer than what you usually do to get refills and things like that. But canned foods, water, particularly bottled water, that you have that available to you.
One of the things, Dr. Fauci, that kept coming up when we asked people to get extra medications, for example, people kept saying, look, my insurance doesn't cover me getting extra medications. I can only get a certain number of days worth. Is that something that's being addressed? Because it seems like a really practical concern for people who are trying to stock up.
Yeah, that's a great question, Sanjay. As a matter of fact, the other day I mistakenly asked for a refill because I got the date wrong, and they said, I can't give it to you. I wasn't trying to stock up. I just made a mistake, and they said the insurance wouldn't pay for it. I think that's something we really should look at. I mean, we're looking at relieving a lot of regulations and other things to make it easier for people to cope with this. I don't want to be saying it absolutely should be done, but really somebody should look at that.
Yeah, because now I had the same situation. I ended up just paying cash for a 2-month supply, but I'm lucky that I was able to do that. It'd be great if the insurance companies gave a break on that. Stephanie Robinson in Newton, Massachusetts. She's a professor at Harvard Law School. Stephanie, what's your question?
So I'm wondering if you can be a bit more specific about what constitutes a pre-existing health condition that would have someone be at greater risk regarding the severity, of course, and the possible fatality of COVID-19. So, for example, asthma. We know that we have 25 million people or more who are impacted by this disease. Is this the type of disease that we're talking about would have cause more complications?
Yeah, I mean, asthma, obviously, there are different degrees of asthma. I mean, if someone who, whenever they get an upper respiratory infection, really dramatically exacerbates their asthma, I think you would say that that person would be at a higher risk. The classical ones are things like chronic congestive heart failure, chronic pulmonary disease, diabetes, and anybody who really is on any immunosuppressive regimen, be that for cancer, chemotherapy, autoimmune diseases, and also the elderly. Now, among the group, the elderly plus that is even more at risk. And if you look at the serious complications and ultimately the case fatality rate is very heavily weighted to those individuals.
Dr. Fauci, you've worked a lot on HIV over the years. If somebody's HIV positive but undetectable and otherwise healthy, is that a factor that they should take into account? that makes them at greater risk?
You know, well, I mean, obviously, I've been taking care of thousands of patients with HIV over the years. Today, if somebody has a normal or close to normal CD4 count, has got an undetectable viral load on antiretroviral therapies, they could possibly be at a slightly greater risk, but I don't think it is anywhere near the risk of somebody who really has a compromised pulmonary function, compromised kidney function, diabetes, and things like that.
There's another question from Ingrid from Maryland. It was submitted online. She wants to know, if airplanes have such superior air filtration systems as reported, then why the advisory for those age 60 plus not to travel by plane, and how come public transport is still okay?
That's a good question. I think we need to look at every aspect of it. You know, and as we say, the CDC's got some guidelines out about, you know, a low, intermediate, high kinds of mitigation that you might do. I mean, if it isn't public transportation involved, again, we need to seriously look at it. Everything needs to be on the table, Anderson, right now. This is a serious situation.
Can I just ask again? I mean, I pointed out you're 79 years old. I hope that was okay that I told people your age. Are you traveling on planes? Are you? I mean, you're a busy guy. Are you out there?
You know, I'm not out there, Anderson. I haven't even been confronted with that possibility. I've been completely locked in and responding right here. I've canceled virtually everything that I was going to be doing purely because I'm literally locked into this 19 hours a day, anywhere from the department down to the White House, down to the kinds of response being in the media. So I'm not going anywhere for a number of reasons. And also, many of the things I would have done have been canceled anyway.
Would you though get on a plane?
Would I get on a plane right now?
Yeah.
You know, it depends on what the issue was. I mean, if I had to do something that was absolutely important, as you know, Sanjay, you know me, I'm a pretty healthy guy for 79. Yeah, I mean, I might take a second thought. I wouldn't do anything that's unnecessary. I certainly wouldn't get on a plane for a pleasure trip. It would have to be something that was really urgent. My job is the public health. If it had to do with the public health and I needed to do something for the public health, I might do that because I'm quite healthy. However, if it was just for fun, no way I would do it.
We got a lot of questions that the next questioner has. Emily Mitchell, Salt Lake City. Emily, what's your question?
Hi, Anderson. Thanks for having me. My question is regarding the mail. I'm a stay-at-home mom and I do a lot of online shopping. So I'm curious how long coronavirus lives on surfaces and how we should be handling the mail.
We got a ton of these, Dr. Fauci. Mail, also money, currency.
You know, there was a paper that was either submitted or already published from one of our people who looked at the detection of viable virus on a variety of substances, stainless steel, polypropylene, cardboard, cloth, and things like that. You know, for the most part, the titration of it and the titer of it on surfaces is probably measured in a couple of hours. I would think something that goes through the mail, by the time it gets to you, that's it. And even if it is on there, would it be high enough of a concentration to actually be transmitted? So although it's important, I don't want to downplay the recommendations of wiping down the kinds of things that you could easily wipe down, you know, doorknobs, screens, and things like that. I think if you start thinking about money and mail and things like that, you could almost sort of immobilize yourself, which I don't think is a good idea.
Yeah. Dr. Fauci, we really appreciate your time.